there's an unconscious casualty lying on their back with a suspected spinal injury. The first aider has supported the head with her hands using manual inline stabilisation to protect the spine. Then they become concerned about the airway. Perhaps the casualty has vomited or they're making gurgling noises when they breathe. Obviously, the first aider needs to turn the casualty onto their side urgently to clear fluids from the airway. We've known for many years that first aid guidelines need to be as simple as possible to give the first aider the best chance of helping in panicky emergency situations. And this revised spinal recovery position does exactly that. It enables a solo first aider to quickly turn a casualty onto their side, protecting the airway whilst minimising movement of the spine. Let's take a closer look at how to place a casualty in the new spinal recovery position. Firstly, the first aider needs to move to the side of the casualty, even though this means letting go of the head. Kneel at the side of the casualty and cross their legs, bringing the far leg towards you. Carefully slide the casualty's nearest hand under their head, palm upwards. Do this with minimal movement of the head. It is acceptable with spinal injuries to carefully manoeuvre a casualty's head into a neutral position. And in fact, when lying on a flat surface, the spine is in the optimal neutral position when the back of the head is raised by about 2 centimetres from the floor. Of course, it's vital not to lift the casualty's head too much, which is why the guidance says to slide the hand under the head and to do this with minimal movement of the head. The best way to teach this in the classroom is for the first aider to place the casualty's nearest hand above their head, palm upwards. Without moving the head, the first aider carefully places their spare hand under the arch of the casualty's neck. Support the head with that hand and then slide the casualty's hand under their head from above until the back of the head rests in the palm of the hand. Next, bring the casualty's other arm towards you across their chest and then grasp the far shoulder and the hip simultaneously. Now, pull equally on the shoulder and the hip to roll the casualty towards you onto their side. Pulling equally at the shoulder and the hip is better than pulling on the knee because it places less twisting forces on the spine. Next, adjust the upper leg so the hip and the knee are at right angles. Note now that the guidance says to continually monitor breathing until emergency help arrives.